So today's topic is battling disparities in myeloma with the Florida community chapter. And I really wanted to give local opportunities for you to recognize what's going on in healthcare. Why are there disparities? What kind of disparities exist? And then action steps. What can we do to battle those disparities and make sure that everybody is receiving the same kind of care and have the same chance at a cure for myeloma? Here to talk to us about that today is Marsha. Marsha is passionate about helping and empowering others, and she served her community for over 35 years as a lawyer and consultant. A little over 5 years ago, multiple myeloma became a shocking reality when her husband was diagnosed, and she's been a caregiver to him since that time. And although she was devastated by the initial diagnosis, her family has been blessed as their myeloma journey continues. Working with HealthTree as the director of the Black Myeloma or African American Myeloma Initiative allows her to focus her energy on giving back to families and hopefully giving them a chance to become aware of and educated about myeloma. When she's not working, she's laughing with her mom, husband, 3 adult daughters, and the joy of her heart, her grandson. The entire family is overjoyed to finally get a boy. And Dr. Fatoki has recently graduated from his internal residency at Kaiser Permanente in San Francisco Bay Area. And then he made the big move to Miami, Florida for a fellowship at the Hematology Oncology Center at the Sylvester Comprehensive Cancer Center. And he has an interest in myeloma. He's going to be explaining his story and a little bit more about him as a part of his presentation later tonight. If you ever want to, during our group discussion, if you want to speak out loud, feel free to raise your hand. You can do that by clicking reactions and then raise hand. We'll wait to call on people until the presentations are over, but I just wanted to let you know that if you do want to ask your question out loud and participate in a group discussion, we're in tiny numbers, so maybe you can just unmute, but you're also able to virtually raise your hand. And with that being said, I'm going to start sharing Marsha's slides and we can get started with your presentation, Marsha. Thanks for being here tonight.
Thank you, Audrey, and thanks for the invite. I'm always pleased and excited to share about our initiative because it is near and dear to me. I am also excited to share the hour with Dr. Fatoki. I can't wait to hear about what he's doing in this space. Whenever I find people who are working in this space, it just, it does my heart good to know that others are interested and that we are going to make a difference, because I truly believe that we will. So my first slide is always our website, because I want you to see it. I want you to visit. I want you to visit often, blackmyelomahealth.org. And it's all about disparities, battling disparities, becoming stronger together as we battle these disparities and promote equity and advocacy for all myeloma patients. You can go to the next slide. The agenda, I'll just go through this quickly. We're going to share Jenny's perspective on this. I'm going to share a little bit about just the mentality of the Black community. We'll talk more about health disparities. We'll talk about the facts as it relates to myeloma and African American patients and patients of African descent. We'll talk about goals and what the community, what we're doing as a community, all of our programs and resources. And then the last part is always the most important for me. It is the call to action. It's that clarion call that I send out, because it does take a village. And I believe everyone that will hear this video and everyone that is present tonight can make a difference. I always start with a word from Jenny. And I do that because I grew up in corporate America, and I subscribe to that notion of from the top down. And, but leaders of organizations have to make sure that the people under them are along for the ride, if you will. You have to get buy-in from those who are not necessarily in top leadership, but you need buy-in. And that's why I always want everyone to know Jenny, our founder here at HealthTree, how she feels about this initiative. As Audrey said, I am the director of the Black Myeloma Health Initiative here at HealthTree. And it came about because of exactly what you see here that Jenny says. And I'm just going to read it quickly. The myeloma incidence in the Black community is 2 to 3 times higher than any other group. There's a deep need to reach these patients. We've provided all of our myeloma programs over the last 10 years, and we realize that the Black community is not taking advantage of the programs and services we have to offer. There's a great need to try new approaches. The African American myeloma patients are not living as long as other myeloma patients because they're not getting the same care, even with lower risk multiple myeloma genetics. Self-advocacy will go a long way to help improve outcomes. The goal is great care and education for everyone. So when Jenny talks here about trying new approaches, she brought me in to do just that. And that's what I'm committed to. And at times you will hear me say African Americans, at times you will hear me say Black, at times you will hear me say, patients of African descent. I'm including all of those groups, okay? I use African American and Black interchangeably, not everyone does, but I wanna make sure that if I say African American, I'm also talking about my brothers and sisters who are not necessarily American, but they are of African descent. And I always want to make that clear as I speak. So this slide here, this is kind of background on us, if you will. I think that when we're asking a population outside of ours to do something and to help us, I think that there needs to be some background. You need to have context. You need to kind of understand culturally what African Americans are about. And that's why I include this slide, because I am going to ask for your help. I don't care who you are. I don't care of your ethnicity. We need help. And so I want you to understand the cultural significance of some images and some language that you will see on the website. You might hear me even say things tonight. First of all, on the left, you see this symbol. It is a West African icon, and it's symbolic of help and support. As you give, you will receive. And we use that icon on our website. We use it in the Black Myeloma Health Facebook group, in the chapter. You'll see it on some of our materials, but it's all about that idea of support. So we wanted something that when Blacks saw that symbol, they know that, okay, this is for me, I will pay attention. So as a collective body, just a quick history lesson, as a people, African Americans are resilient and strong in the face of adversities. We've had a lot. Not to say we are the only population that has adversities, but we've had a lot. So historically, we had to look within ourselves, our homes, our churches, our communities for support. The larger population isn't always interested in helping us. So we have to help ourselves. If we are to be saved, we have to save ourselves. So we're tribal. We share common culture and traditions. Having a village is the norm for us. I talk about my village all the time. When my husband got sick, my village showed up. Even before my husband got sick, as we're raising 3 daughters who played sports and danced, and we had to travel the US because they were, playing and dancing at a higher level. It was my village. It was just 2 of us and it was 3 of them. So my village had to step up. And we truly believe that life is not meant to be done alone. And that's where the sense of community comes from. Hands. I want to touch on the relevance of seeing hands. This visual here, we have a similar one on our website, blackmyelomahealth.org. Hands represent helping each other, lifting those up who are in need, supporting them. We pray for each other. Even from a spiritual or religious standpoint, a church standpoint, you know, we used to sing in my little country church, hold to God's unchanging hand. And there are songs now that talk about, you know, when you listen to gospel music, about the hand of God. So hands are important to us because it means that we're helping. The overarching sentiment for this initiative is all about, I am my brother's keeper. It goes back to that village idea. It goes back to that collectively, we have to be a community. And I am my brother's keeper is consistent with one of the principles of Kwanzaa, Ujima, which means collective work and responsibility, building and maintaining our community together to make our brothers and sisters' problems our problems and to solve them together. So that is the backbone. That's the sentiment of our initiative. So I just wanted to share that so you can keep that in mind as I talk about the programs and what we're doing. You can go to the next slide, disparities. So I always like to pause here because disparities in healthcare, these are the things that aren't feel good type things. These are the things that affect us. I mean, to the point of it could be, you know, affecting whether we live or not, or the quality of care, if we do live, the quality of care that we receive. So I call it the myeloma tapestry. You know, look at each of these squares here. I want everybody on this call, look at these squares. And if you're a patient or even a caregiver, like find your square. There is a square here that represents your myeloma journey or your loved one's myeloma journey. None of these squares are alike. They're shaped the same, but they don't have the same, pattern. And that's what happens with myeloma. Keep that in mind about this myeloma tapestry. And along with that, I like to share a quote from Dr. Maya Angelou. And this was all about diversity. And what she said was, we all should know that diversity makes for a rich tapestry. And we must understand that all the threads of the tapestry are equal in value, no matter what their color. So think about that. You know, think about your myeloma journey. And think about when you're out and you see other myeloma patients, they should have the same value no matter the color. And that's what is not necessarily happening. And that's why I have to talk about this slide, disparities and inequities. And I'm not going to read this entire slide to you, but I want to give you a sense of the types of disparities that perhaps if you haven't been touched by this, you might not realize this as it relates to myeloma. And by the way, this is not just with myeloma. I'm just concentrating on myeloma. This is across healthcare. But one thing, think about a myeloma patient, dismissal of symptoms. I want you really to internalize this, everybody that's hearing this, because what if it was you? What if when you presented to the ER or your doctor, your symptoms were just kind of dismissed? So one thing that happens is African Americans, people of African descent, are not taken seriously all the time. Initial symptoms are not properly evaluated all the time. There are racial biases out there that exist in healthcare. And one of them is that African Americans have a higher pain tolerance. I don't know where that came from. Perhaps the doctor does, but I don't know where that came from. But that's not necessarily true. And if you are being attended to by a healthcare professional who believes that, then what they prescribe for you and what they say to you and how they try to help you can be affected by that. There's this racial bias that Blacks may just want drugs or may just want to get painkillers. There's this whole idea of you walk in with your brown skin and you are immediately judged just in terms of what your job might be. It's rarely that they think career. So really it's usually what your job might be, what your education levels might be. They are questioned. And I will be honest with you all. I go around a lot in t-shirts, hoodies, jeans. And if I feel that I am being judged or my education level is being questioned, I am immediately not happy. So then I have to start telling you, you want to know what my education level is? Let me tell you. And I shouldn't have to go through life doing those things. My mother, who only has 1 year, one semester of college under her belt, 89, she couldn't finish. She shouldn't be judged because she didn't get to finish college. And so that is a major problem when we talk about disparities. This whole feeling of being overlooked and not being seen. We have to address these disparities. In myeloma, there's the misdiagnosis and delayed diagnosis. So we're not being diagnosed in a timely manner. Doctors aren't really proactive in ordering the tests that could determine if we have it or not. Just accepting that African Americans are anemic. That's another one. Everybody has 5 of us in our house and all of us have been told we're anemic. Well, we're not just anemic because we're brown. We just aren't. There's an underlying reason. It may be serious, it may not be serious. But this whole idea of delayed diagnosis, it touches me because my husband's diagnosis was delayed. And while he was we're trying to figure out what is going on with this seemingly healthy 57-year-old ex-athlete, the myeloma protein was damaging his kidneys to the point they're out, blew them out. He now needs a kidney transplant. So those are just other disparities. Again, think about if this were you, like you wouldn't want this. The additional contributing factors, a lot of those are around just social determinants of health. A lot is around unaware of treatment. Blacks are unaware at times of treatment options. There's a lack of access to information regarding myeloma. There's a lack of access to the academic centers because maybe where you live, you just you can't take 3 buses to get to that academic center. Like all of these things affect Blacks with myeloma. Limited involvement in clinical trials. Numbers are way down. Enrollment, it's not happening. I'm happy every time I hear somebody who is saying, I am in one of the myeloma clinical trials. But as a rule, that's not what we're doing for several reasons. One is the distrust. We don't trust. And then the healthcare professionals aren't giving us a reason to trust. You know, the healthcare professionals are still calling them trials. Well, when you talk to a Black person about a clinical trial, that's not going to work because we think back historically to what happened in those trials. And no, you're not going to trick me again kind of mentality. So it's on all of us that we have to do something. We have to change the language. The healthcare professionals there has to be this cultural competence that they need to help Blacks understand that these clinical research opportunities are important to them. So I'll go to the next slide, but I just wanted to set up the disparities. And again, just think about if that were you, you're sick, you're trying to figure out what's going on with you. And so that's hard enough in and of itself, but then you have all of these other barriers and these hurdles that you have to try to get over as a sick person trying to be diagnosed so you can get help. This slide, I always like to tell people the facts because what I have found since January, I've been doing these presentations. Not everybody knows the facts about African Americans and myeloma. So I like to take the time to tell you, just in case you didn't know, that Blacks are 2 to 3 times more likely to develop myeloma. African Americans have a higher incidence of the precursor condition, MGUS. While the national population of African Americans within the US is only around 13.4%, Black myeloma patients make up 19% of the US myeloma population. And lately I've seen that edge up a little, 20, I've seen 21%. But the point is, we don't make up the bulk of the population in the US. However, the myeloma rates are higher. Younger diagnosis, African Americans generally present with myeloma 4 years younger than their Caucasian counterparts. And this last bullet is the one for me that is just so relevant. The potential for better outcomes. Black myeloma patients typically have lower risk myeloma at diagnosis and can have better outcomes than Caucasians if treated with equal therapies. That if is huge, that's the operative word there. So when I see that, I'm like, okay, Marsha, you have to do everything you can so we make sure that we are getting those therapies, those equal therapies, to give us a chance at living. Out of 100,000 cases, white men, 8.8 cases, Black men, 16.5, white women, 5.7, Black women, 12.0. Again, I see those percentages inching up, but basically that's what it is. This visual here on the left, understanding inclusion, I was on Twitter one night and I ran across this, and you know, my brain never stops, and I'm thinking, wow, like when I read it, it just spoke to me. So I'm using the book as the analogy. Understanding inclusion. Equality is that everyone gets the same book. Diversity is that everyone gets different types of books. Equity is that everyone gets the book that is right for them. Acceptance is understanding that everyone reads different types of books. Belonging is reading any book you want without fear of being judged. And justice is fighting to make sure everyone has access to books. Okay, guys, inclusion for us is bigger than a book. We are talking about our lives. And this is why it matters so much. So when you think about this, as it relates to myeloma, equality is that everyone gets the same treatment. Diversity is that everyone gets different types of treatment. Equity is that everyone gets the treatment that is right for them. Acceptance is understanding that everyone needs different types of treatment. Belonging is getting any treatment you want without fear of being judged. And justice is fighting to make sure everyone has access to treatment. And when I look at that, like equity and justice, for me, those two things stand out. Those things stand out for our Black patients. The goals, we are spotlighting myeloma. You can go to the next slide. We have a team, I'll go through this quickly because all of this is on the website. We have a team that's dedicated to working with Black patients, for Black patients. I am the director of the initiative. Valerie, who leads our Black Myeloma Health community chapter and our Black Myeloma Health Facebook group. She has done a wonderful job in creating community with these two groups. Her monthly webinars cover topics that are absolutely relevant to the Black patient and the caregivers. Diana, who's also a coach, but she's our financial program director. She helps with all things financial, insurance, all of those things. Diana is helping educate our patients and our caregivers. And we have Constance, who is our patient navigator. So she works with our Black patients and caregivers. She works with others too, but she, if anybody needs any help with navigating HealthTree or trying to figure out things about your treatment or whatever it is, Constance is the one that can help you. We also have a team of coaches. Roz has a coach who leads our coach program, and there are about 19 African-American coaches now that we are really pleased with. So anybody that's listening to this call, if you want to talk to somebody and need to talk to somebody about any aspect of your myeloma journey, look into the program, the coach program on the HealthTree.org website. So the goals of my initiative, the Black Myeloma Health Initiative, I say it's simple. It's awareness, education, outreach, and advocacy. So awareness, because awareness is low in the African-American community when it comes to myeloma. What is multiple myeloma? The doctor told me my husband had multiple myeloma. I said, okay. And I looked at him and I said, so what is that? I had no idea, had never heard of it. Education goes hand in hand with increased awareness. So what tests should I request? What are the symptoms? So a lot of the programs that I'm doing, it's all about awareness, increasing awareness and education in the Black community. Outreach, it empowers communities in their pursuit to enhance the well-being of everyone who lives there. So here's where I leverage community partners. I am pleased with the amount, the number of partners that we have now. And I am every day looking for more partners that we can connect, we can collaborate, we can educate, we can make aware, and we can help Black myeloma patients. So that's the whole outreach piece. And then advocacy is creating those resources, providing patient navigators to support our current patients. What barriers can, those disparities I talked, what barriers can we eliminate? Well, how can fair and equitable treatment be achieved? That's what our advocacy program is all about, looking at social determinants of health and seeing where people are and where they live and their education and their lack of transportation and lack of food, fresh food and produce, like all of that comes into play. And then all of that leads us to a strong community. It's essential, though, that we build trust within our community. African Americans don't trust easily. We just don't. And so you're going to have to show us that, the trust is going to have to be earned. You're going to have to show us you're genuine about wanting to help us. And that's when hearts and minds are open, we lock in, we come together for this common goal, and we make things happen. Community, stronger together. That goes back to that I am my brother's keeper that I talked about in the beginning. I'm not going to read all of this. These are just some of the things that we've done this year that I'm really proud of. Val and I work closely together to put these things together for our program. We have patients and caregivers participating. The Spotlight on Myeloma, Val has patients and caregivers do short video series. We have a written series, My Story Matters, Hear Me Out. I mentioned the Facebook group and the chapter that Val leads. We are having special events. We had a Juneteenth event that was, people still talk about that event. It was educational, it was great. Around awareness, we just did the virtual 5K, HealthTree Moves for African American Myeloma Awareness, and it was a success for our first one. It was a success. We raised over $16,000. And so we'll be back to do that again. We have the Reppin' the T campaign. I don't know if you can see my t-shirt, probably not, blackmyelomahealth.org. We let our patients and caregivers, if somebody wants to, because we want patient ambassadors across the US. If you will agree to distribute our snapshot, our one-pager about African Americans and myeloma, or the pamphlet, we'll send you this t-shirt. When you go to your doctor visit, take these pamphlets and hand them out to other Blacks you might see, or even to your doctor's office so that they can distribute them. Education, I still want to do a campaign. I haven't yet. Doctor, could this be multiple myeloma? Teach our people enough about myeloma to say, if there's something you're trying to be diagnosed with, Dr. Fatoki, could this be multiple myeloma? And what will he do? He will say, well, I don't know. but let's explore that further. That is the goal. Outreach, health expos, cultural events. I've been to probably 5 or 6 expos where it's primarily Blacks, handing out my brochures, just talking to people. They have thanked me. For years, I've been doing trade shows and never have I been thanked. Thank you, Marsha, for this information, but we're trying to make a difference. You see the partnerships, Triage Cancer, the Leukemia and Lymphoma Society. I'm in partnership with Dana-Farber with their PROMISE study, where they will do screening for the precursors to multiple myeloma. IU Health, Indiana University, Black Mental Health Symposium. I just attended that conference and ended up getting another, hopefully another partner who is in the healthcare field who will help us get the word out. And then advocacy. I always like to talk about the HealthTree resources because that's what I want our patients and our caregivers to know. There's the coach program that I mentioned. There's HealthTree University that you can learn anything you want about myeloma. Our hope in 2023 is to have a curriculum for Black patients taught by our Black specialists, our Black doctors who will come in and do these short videos. And then there's Cure Hub where you can track your myeloma. Last thing I'll mention on that, we did win a innovation award, GSK Innovation Award, Target the Future Think Tank Challenge. Our program was described to them and they picked us. We also talked about, you can go to the next slide. We talked about our Spanish speaking resources. So our diversity, equity, and inclusion program is about to go to another level. We are expanding it. We are thinking about those social determinants of health, that what can we do to affect those? There are things that we can do. And so you'll hear more about those coming up in the first quarter of 2023. But as of now, we're starting these pilots where we will work with facilities that service primarily Blacks and Spanish speaking populations. And for them, we will have targeted in-clinic workshops. Val and myself will go to talk to patients about what HealthTree has. We'll also go to train the staff so that when we're not there, because we can't be everywhere, that they can talk to their patients about what we have to support Blacks and Spanish speaking patients. Right now, HealthTree referral forms and patient navigators. Sometimes people won't be proactive about seeking resources. So what we've done is created electronic referral forms in English and Spanish that the healthcare professional staff is using to get the consent of those patients to be contacted by HealthTree. So we have a whole patient experience team. Constance is part of that team, but they will reach out. If a patient gives their consent to be contacted, our patient experience team will reach out to them to try to help them. For the Hispanic population, there are Facebook groups, there's a community chapter, and then there are Spanish-speaking HealthTree patient navigators on staff for phone support. And there's a course in HealthTree University that is for Spanish-speaking patients too. So in summary, I said all of that to say that together we can do this. We can do this. We can make a difference in the lives of everyone. All of us can spread the word. All of us can increase awareness. Remember my book analogy, like equity. We can focus on equity so that every myeloma patient gets the treatment that's best for them. Let that be a focus. We can fight for justice to make sure that everyone has access to treatment. Because remember what I said, not all Blacks have access to the best treatments. They don't even know about them. just because of their situation. So we're not excluding anyone, and we need everyone. So we need your help. It goes back to this village that I talked about. We need your help in spreading this word and making all of the new therapies available, or at least making everyone knowledgeable of them. Audrey, I have a question. Did we do the poll in the beginning?
No, we didn't, but we can do that now if you'd like.
Yeah, I'll stop there. Let's do, it's just a quick poll, and then I'll turn the floor over to the doctor.
So the poll, you should be able to see it on your screen right now. The question is, do you usually see Black myeloma patients in your doctor's office or clinic? And you can just simply choose your answer and then click submit or enter at the bottom of your screen. It's looking like right now, 100% of people are saying no.
They're not seeing Black myeloma patients when they go to the doctor. Okay.
So I'll leave that up for a little bit. And yeah, I think we'll leave that up for just a teeny bit more in case there's anybody else that would like to enter in their answer, but go ahead, Io, to start your presentation. And thank you so much for being here tonight.
Thanks for having me. This was great, Marsha. I really enjoyed your presentation. And I was laughing to myself when you mentioned that most people don't realize that Black folks have higher rates of multiple myeloma compared to the average population, because I thought about it and I said, most doctors don't even know that.
Yeah.
Right. That's right.
Okay, but I'll go ahead and get started with my portion of the talk. And I guess I can introduce myself first. And my name is Io Fatoki. I'm a hematology oncology fellow at the University of Miami. And I also work at Jackson Memorial Hospital, as well as the Sylvester Comprehensive Cancer Center in Miami. And so I don't know how many of us on the call are actually in South Florida right now, but I am new to South Florida. With this topic of disparities in multiple myeloma, especially disparities in people of African descent, is a topic that's near and dear to my heart. And it's a big reason why I wanted to be in Florida for my specialty cancer training. So before I kind of get into the main portion, I really just want to say thank you to Audrey, thank you to Marsha, thank you to the chapter. This is my first time participating, but I'm hoping this is the first of many. All right, so you can see the discussion topics listed on the slide. So what I'm planning to do for the next 10 to 15 minutes or so is I'll give you a little bit more information about me and how I got interested in myeloma. I'll also highlight some work that the University of Miami is doing here in South Florida to help improve disparities in multiple myeloma, as well as other cancers or just cancer disparities in general. And then I'll close out with what I'm calling my top 3 things that you can do to improve disparities. And much of it will overlap with what Marsha has already recommended. Here we go. Okay. So just to give you some more information about me, I'm originally from the Windy City, Chicago. But I left for college and I've kind of bounced around the country since then until ultimately settling in Miami earlier this year. And so I went to college at Howard University where I studied economics, then went to Meharry Medical College for med school, where I also got an MBA at Vanderbilt University through their combined MD-MBA program. Then I moved out to the Bay Area to Oakland, California to do my internal medicine residency with Kaiser Permanente. And so here I am now in South Florida for my hematology oncology training. And I'm really here because of the diverse patient population, in addition to this pretty strong multiple myeloma program that they have at UM. But the last piece, which is what I'm going to get into later on during this portion of the talk, is the focus that UM has on improving cancer disparities, which is something that I haven't necessarily seen at cancer centers around the country. And so for me, being able to participate in a discussion like this is really what fuels me, and it's exactly why I came here to Miami. All right, so next I'll get into what got me interested in myeloma, and I'm not going to restate everything that Marsha already covered, but I do want to highlight a few points that caught my attention, and she covered many of these points previously. But through my learning and getting exposed, I realized that Black folks are diagnosed at nearly twice the rate of white populations. We're often diagnosed at younger ages, and we don't really get access to these novel therapies. I learned so much early on about the advances that we've made in multiple myeloma as a field, really, expanding the overall survival from maybe 2 to 3 years, where it was 20 years ago, to now patients living as long as 10 years and even longer. But what you'll find is that some of those novel therapies that created the outcomes or created these success stories, Black patients don't necessarily have access. And that's represented in some of the demographic numbers, because when you think about it, as Marsha already mentioned, Black folks are about 13% of the US population, around 20% of new myeloma diagnoses. But when you look at the clinical trials that lead to the approvals of these groundbreaking drugs, we're less than 5% of the population in those trials. And, I think it's pretty clear throughout healthcare that there are disparities for Black and Latino patients, but myeloma itself has always been a little bit different to me when it comes to disparities, because it doesn't seem like it's just a result of poor access to care. I think there are other illnesses. I think about like hypertension and diabetes. I think about colon cancer, even prostate cancer in some ways, where poor access to care or lack of screening is really what drives the disparity. Myeloma is a little different, and it seems to have some sort of genetic component, because we've seen similar outcomes or similar findings in West Africans, the same way we see them in US Black patients. So, even if you're educated, and even if, you're well off financially and you do everything that your doctor recommends, you're still more likely to be diagnosed with multiple myeloma and receive the diagnosis at a younger age. So that really stuck with me and caught my attention as a big reason why I got excited. And also, we don't really know much about myeloma in Latino folks or in Native American populations. And so I started thinking about it and asking myself, and I figured, someone needs to be doing this work, so why not me? So that's how I got into myeloma. And so next, I'll really focus on what is happening here in South Florida. And so I mentioned that some of the work that the University of Miami has been doing when it comes to cancer disparities was a big factor in me choosing to train there. And so I'll highlight some of these efforts. And I will say that is making an effort to improve cancer care disparities or cancer care in Black populations in a variety of cancers. But I do want to be clear that we can do a much better job improving myeloma care for Black patients, not only at but around the world. So I don't want to make it seem like we have everything all figured out. And then just quickly, before I get into some of the other cancers that we're making really great progress in, I do want to mention that here at Sylvester, we're building out a Latino cohort of myeloma patients as part of a clinical trial. So the researchers who are in charge of that are really trying to see, are there similar disparities or similar worse outcomes in Latino populations that we see in Black populations? And I wanted to highlight this because this is something that's very interesting to me personally. In my personal life, I'm pretty fascinated by the movement of people over time and some of the lasting effects of the Atlantic slave trade, especially as we start to explore genetics and its role in disease. So I'm excited to see what multiple myeloma is like in people from Latin America and from the Caribbean, since we know there is some shared African ancestry. And so if anybody is also interested in this topic or this trial, please reach out to me via email or Twitter. I'd be happy to chat more. But let's get into what's happening here in South Florida, especially when it comes to And I think, the goal of this portion of the talk is for me to just give some context to what's already happening, to hopefully help stir up some ideas on what we could do to improve myeloma care. But in my opinion, the main focus of the Cancer Center has primarily been research and outreach. And so you'll kind of hear me repeat this over and over: research and outreach, research and outreach. And so, for example, liver cancer is one area that there's been great success. We had a liver specialist a few years ago notice that her Black patients who were diagnosed with liver cancer tended to be a little bit younger and tended to have more advanced liver cancer than some of her other patients. And so she did a major research study to prove what she was already noticing. And she found that this disparity in liver cancer was primarily due to higher rates of untreated hepatitis B in her Black and Haitian populations here in Miami. And so this is where the outreach portion kind of comes in, because her team partnered with local community organizations, especially some Haitian organizations here in Miami, to help spread the word about liver cancer and the hepatitis B virus. And what that led to was better hepatitis B screening and treatment for our local patients. And that's ultimately going to save lives and improve disparities, because we're going to see lower rates of liver cancer just because of the research and just because of the outreach that was done. So again, you're going to hear me say this over and over: research and outreach, research and outreach. And I'm hoping that we can start to build up some ideas for what we can do in myeloma. And so it's not just liver cancer. There's also a big push at the University of Miami to enroll Black men in our prostate cancer trials, because similar to multiple myeloma, Blacks are diagnosed with prostate cancer at higher rates than white patients, but we're often underrepresented in clinical trials, which makes a lot of physicians question if we can even apply these prostate cancer trial results to the population that we're seeing in our clinic. And again, the only way that we're going to be able to improve on this is to build partnerships with the community via this outreach that I keep mentioning, with the hopes of recruiting more people on the clinical trials. So, it's not just myeloma, it's not just liver cancer, prostate cancer, in addition to others. And, the last one I'll focus on really will be breast cancer for today, because to me, again, this is another area where research and outreach are making a difference in saving lives. So there was some research done by University of Miami scientists that showed that Black Caribbean women have much higher rates of BRCA, or the BRCA gene mutation for breast cancer, which is associated with much more aggressive disease. So there's been a bunch of outreach to the Black Caribbean groups here in Miami from that research team to improve breast cancer screening. And again, that outreach is how we really make a difference. And so, Marsha, I loved earlier how you were talking about awareness and education and outreach. And, I'm really just trying to piggyback on that and emphasize the importance. We have to gain information ourselves, whether it's through just learning on our own or doing the research, as scientists and physicians. But we've also got to get out and share, and we've got to build partnerships with communities to figure out the best way to accomplish our goals. And so I'm going to jump into my last slide, which is the things we can do. And again, this really is very similar to what Marsha mentioned, but I'll say, she had a lot more specifics and examples. And so I think if there's anyone who's getting motivated and feeling like, hey, I want to make a difference, please tap in with HealthTree, and let's see how we can work together. But to me, it all starts with education. And
We lose him. He had a hurricane coming his way, so
I think he's frozen. He might come back.
yeah, we'll give him a minute.
Yeah, he has some bigger things to be concerned about.
I know. I wonder if the hurricane took the.
Okay, there we go. I'm back now. But yeah, I think that I'm going to blame that on the storm.
Yeah.
But again, just mentioning the importance of education. And I think with more education and more information, patients and caregivers and family members, we can start to feel more confident about having nuanced discussions with our physicians. And so that's where it gets into the second point. I really want to encourage everyone on this call to talk to not only our doctors, but talk to our friends and family about clinical trials. I think, when I look back at the success that we've had or the progress that we've made in the field, it was entirely because patients participated in the clinical trials, and there were people who empowered themselves to get more information and really get involved. And so for me, ongoing research and very diverse clinical trial participation is the only way that will improve these outcomes. So again, I want to encourage everyone, talk to your doctors, talk to your family members. If anyone gets a new diagnosis of myeloma or a new diagnosis of any malignancy, ask about clinical trials. And I think it's important for us to know, why are clinical trials even important? How are they designed? And how do they ultimately lead to drug approval? And I think participating in forums like this, and we'll only get more information and we'll only get educated better, so we can make that difference and participate more. And I think the last piece, as we've mentioned several times, is just outreach. I think we all have a role to play. We have to stay engaged. There was some discussion in this group earlier about how we can get more people to engage with the resources that HealthTree and BlackMyeloma.org have to offer. And I think it's going to be each one of us doing our part. And so I've already mentally committed to doing some outreach on my own so that I can get a t-shirt like the one that Marsha has. And so again, I tried to keep it simple and very high level, but to me, the biggest things that we can do to make a difference are to continue to educate ourselves. So I want to say thank you to everyone for participating tonight. I think the next piece is to please ask your doctors about clinical trials, ask your friends about clinical trials, ask your family about clinical trials. Just because someone says they have a diagnosis of cancer doesn't mean that the treatment is already set or there's no treatment whatsoever. please ask. I think the last piece is we have to get involved. We can't be gathering all this information and talking to doctors about clinical trials and then not sharing it with others. And I think that sharing and that outreach part is how we're really going to make a difference. And so with that, I will close. I think we're almost at 7:30, but I wanted to open the floor for any questions and let's talk about what we can do.
Thank you so much. I am going, one of the things that we can do, so let me share these results because I think this is pretty interesting that 100% of people that took the poll said that they're not seeing Black myeloma patients in their doctor's office or clinic. And that we can have several follow-up questions upon that. But before we finish that out, let me do the post-meeting poll. So there's 3 different questions for participants to take to answer. The first one says, I better understand the issues of inequities within the Black myeloma community. Number 2 says, I am committed to doing waiting room or infusion room advocacy, sharing HealthTree's message with patients and/or nurses. And number 3 says, I will request HealthTree's targeted trifold pamphlets to share with Black patients at my doctor's office and/or clinic. Now, just because you're not seeing Black patients doesn't mean your oncologist or specialist might not be seeing other Black patients at different times. So this would also be sharing with all patients these kind of resources. And in order to request those trifolds, you can email Marsha, Marsha at healthtree.org. So Marsha, if you don't mind, I'm going to be putting that in the chat.
Yes, I want you to put that there.
Marsha at healthtree.org. Please email her if you want a volunteer opportunity. Marsha's full of them. If you want a t-shirt, she'll tell you how you can get one. We even have really special mugs. The Io's gonna get one because he presented here today, so yay. But I'm really looking forward to hearing from you guys about whether or not you're willing to do this. So it looks like 100% of people say that they better understand the issues of inequities within the Black myeloma community. 50% of people are committed to doing waiting room or infusion room advocacy, and 50% of people are undecided, which again is totally understandable. I think there's like a nervousness aspect, and maybe that's not how you show up. Maybe you show up in a different way.
Mm-hmm.
And number 3, 100% of people said they will request HealthTree's targeted trifold to share with patients. So I love to see this. I'm excited to see action, and the power of one is really applicable here. We can make a difference. One thing that I was, to get this conversation started, and again, you're welcome to enter it into the chat, or you're welcome to virtually raise your hand by clicking reactions and then raise hand. We'll just meet for about 15 more minutes, but I wanted to talk about a couple things. So the first thing that was on my mind is both of you were presenting. We could get a cure for myeloma, and yet people would still die from myeloma because they're not being accurately diagnosed, and because the treatments that work for predominant, like the white population, aren't as effective in the Black population because clinical trials weren't able to tell us how different populations reacted. Do you guys share those sentiments or those feelings? And if so, like, what can be done? I mean, we've kind of talked about what can be done for the past hour, but Marsha, what are your thoughts on that? I mean, how can does it look like a flyer? Does it look like Facebook posts? I mean, how can we let the African-American population, it was kind of like what you were saying, doctor, could this be myeloma? Let's talk a little bit more about that kind of outreach. How can we even let people know about multiple myeloma?
Audrey, and that's a great question. So when I came in January, all I knew was we needed to increase awareness and education. And that is why I got busy looking for events, because African Americans, word of mouth is huge for us. Word of mouth advertising, that's what we do. If we like something, we tell our family and our friends. We tell our churches, we tell our organizations. So word of mouth. So it's like, you know, just starting somewhere. And it can be my first event, and you know this, but it was in downtown Cincinnati in Washington Park on a Saturday. There was an event that one of our partners was putting on, and it was just, we had music, we had food, it was a Black People Day in the Park kind of event. And that was so, every piece of everything I had on my table, I had materials, I had mints and gum and masks, and everything was given away. So I think it's the grassroots, it's the grassroots level. It's go to church and share. And I was going to say, in addition to my pamphlet and the brochure, I have a one-pager that is electronic. So for those 50% of the people who were undecided about waiting room advocacy, that's cool. Just ask me for the snapshot and you can send it electronically to as many hundreds of people as you choose. So that's what works for us. And I'll say one last thing and then I'll let Ayo talk. So grassroots is one thing, like just in the neighborhood, handing out information, but also on a higher level. And that's where I talk about the organizations that we as Black people are part of. It's the professional organizations. It's the Black doctors, the Black lawyers, the Black accountants. There's a Black professional group for every career path out there, for every occupation. And it's the sororities and fraternities, and it's the Masons and the Eastern Stars. Like, it's those things that are near and dear to us who are Black people. So with those, just dissemination to the membership of those organizations.
Yeah, that makes sense. Dr. Fatoki, what additions do you have to say?
Marsha, I totally agree with you. I think the grassroots efforts and getting to people are going to be huge when it comes to improving disparities, finding a cure, getting more people on the clinical trials. But I was just taking some notes for myself, and I was trying to think about all the different players or the factors that have a big impact on this. And so I think, people including patients and caregivers and their families is one huge arm that outreach will hopefully help us with. But I think two other aspects of this are thinking about physicians, the people who put together the clinical trials, and also thinking about the pharmaceutical industry who's sponsoring these clinical trials with the hopes that these drugs will become approved and ultimately be sold to the masses. And I wrote down two things that I've been hearing more and more about. I'm not sure how widespread they are, but when it comes to like physician oversight and making sure that physicians are doing our part to improve disparities, there's been a big push to have what they call clinical trial diversity officers within every clinical trial. So the idea being that there's one person, on the leadership of that clinical trial whose job it is to make sure that there's diverse representation within the cohort. And so that's something that to me could help, because I think as physicians, we get so caught up in the patient in front of us, or, just thinking about our clinical trial and whatever outcome we're trying to get, that you kind of forget the big picture. And when it comes to industry or the pharmaceutical companies, I've been reading and hearing about a push to have the FDA mandate that any new drugs that are approved have to have a diverse clinical trial representation, because some people argue, why should we be using our taxpayer dollars to approve these medications that are supposed to benefit the entire population, but we know they were only tested on a subset of the population? And so, to me, all this stuff will take time, but I think the combination of grassroots efforts to people and, the FDA putting pressure on the pharmaceutical companies, and then, scientists and physicians kind of creating some oversight for ourselves, that'll all make a huge difference.
Definitely. Thank you. What about to Marsha's point of like perhaps changing the terminology around clinical trials? Do you see that as a barrier as well? And do you think that would be helpful?
Yeah, I just had a patient yesterday. We mentioned clinical trial, and he says, wait a second, you're going to experiment on me? And then we had 15 minutes, talking about clinical trials. And so I'm hoping that some of these grassroots efforts can sort of demystify trials, and maybe we have to change the name. But to me, it's like, hopefully we can be having these discussions in the community so that by the time somebody gets to me, we're not having to, speak at that level. We can be talking about the nuances.
Yeah, definitely. Thank you so much. This was an excellent presentation. I felt highly educated. I could answer those poll questions and say I learned even more today, and I am even more committed to making a difference. Something that we're also doing And this is very phase 1, phase 0. So don't get too excited, anyone, but we are starting in-person Black support groups because of the grassroots effect and this emphasis on Brothers Keeper community. So we're starting one in Charlotte, North Carolina, and then we're going to also be starting one in New Orleans, Louisiana in the year 2023. We hope that by doing this, we're able to even get people to oncology centers to be seen. And then we can focus on getting people to academic centers, but making sure that people in the community are able to increase outreach, like you were saying, Dr. Fatoki, and that they can connect and share with each other the specific burdens that are within that community. So we hope that though these groups may start small, they may continue to expand and also just enhance our mission of our mission of this Black Myeloma Health Initiative. So we're doing what we can, but we can't do it alone. And so I really appreciate everybody that's attended here today. I appreciate you answering the poll questions, getting excited. Please email Marsha. Please talk to us about any questions that you have or any ideas that you have. We're more than willing to help. And we're excited about this equity. What's it called? Initiative. I don't know. I said that word like 3 times. Why did I just forget it? Anyway, thank you guys so much. I really do appreciate your participation. As I'm going through outro announcements, if anybody wants to add anything in the chat or virtually raise their hand to speak, we do have time, but I'll just go through a couple of quick outro announcements. A big thank you to
Audrey, excuse me, before you do,
of course.
I'm just sending a message to me that I
okay.
wanted to, direct message to me. And it came from Sandra, I think. Is there a month in which multiple myeloma is a focused health observance? So it's March, that's Multiple Myeloma Awareness Month, right, Audrey?
Yes, ma'am. And then September is Blood Cancer
Cancer Month, yeah. And just so, I mean, those on this call know, one thing that I have in my strategic plan for next year is I'm trying to go all the way to the legislature to get Black Myeloma Health Day or something like that established, because I just feel like I'm all about going to the top. I'm like, I'm not sure how to do this, but I'm going to connect myself with somebody that knows how. So we are thinking like that, like, yeah, let's observe March, let's observe September, and let's try to get a Black Myeloma Health Day every year, same year. So that kind of idea. Thanks for the question, Sandra.
Yeah.
Please
Do you have
email
any?
me if you have other questions.
Yeah. Do you have any other closing comments that you want to make, Marsha or Dr. Fatoki?
I do.
Okay. Okay. Perfect. Well, please join us next month on October 27th for the Florida chapter. I mean, this is slightly different than what we've been talking about today, but we're going to be talking about the art of acupuncture and how it could help the Florida myeloma community. So what benefits does acupuncture have? Upcoming events you might be interested in. Tomorrow is our non-secretory myeloma community chapter. That means that you don't have an M protein on your labs. So if this sounds like you, you're more than welcome to join us as we connect with other non-secretory or secretory, however you want to say it, myeloma community members. On the 4th at 1 p.m. is our myeloma financial chapter. Diana Valentine, who Marsha introduced earlier, is going to be speaking to us about finding a treasure chest of assets you already own. And then on the 5th is our HealthTree Moves for myeloma chapter. We're going to be talking about how to stay fit throughout your myeloma journey. Another Black myeloma patient, her name is Jason. She's going to be presenting to us about her myeloma story. She actually broke her back, and that's how she found out she had myeloma, but she was determined to still stay active, even though it looked different than it did before. So if you're interested in hearing her and her story, that's Wednesday at 7 p.m. Eastern on October 5th. The link to sign up for even more events I haven't mentioned, and those events that I did mention, is found at the bottom of the slide and will be sent out in that follow-up email. A big thank you again to our sponsors, Bristol Myers Squibb, GSK, Genentech, AbbVie, and Amgen. And a big thank you to each of you for helping us build this Florida myeloma community. We really appreciate you. I thought this was a great discussion today. Thank you, everyone. Have a great night. And be safe, everyone in Florida. Be safe. See you. Bye-bye, everyone.